An owner calls and says, "Hey, my dog's really not doing well. Do you guys think you can maybe fit him in today?" Vet says, "Sure, what's going on? Tell me a little bit about what you're seeing and why he's not doing well." "Well, he's really just been vomiting and really not himself, doesn't want to walk around, doesn't want to eat, and has some weird muscle tremors." "All right, bring him in. We'll take a look at him, run some blood work, take some x-rays, and see what's going on." So the vet starts doing a physical exam as soon as the dog gets there, and the first thing that he notices is that the dog has a weird yellow tinge, and this is called jaundice.
Jaundice, a medical condition with yellowing of the skin or whites of the eyes arising from excess of the pigment bilirubin, and typically caused by obstruction of the bile duct, by liver disease, or by excessive breakdown of red blood cells.
And he also notices some weird coughing and just not breathing normally. And the vet says, "Let's maybe run some blood work and see what systems are affected and why this is going on." So takes some x-rays, nothing abnormal, starts looking at blood work. So I'm noticing a trend here. There's some weird liver values that are really high, and there's also some kidney values that are really high. The CBC shows that there's some sort of infection going on, a lot of white blood cells are elevated, and just, I'm starting to get a picture of what's going on here. So the vet starts looking around and starts making a differential list. Now, unfortunately, with these clinical signs, there's a lot of things that could be causing them. And so we make a differential list, which is a list of things that could be potentially causing these symptoms. So it could be this, it could be this, it could be this, it could be this. It's less likely to be this, but it still could be, or it could be this and this combined. So he starts making a differential list in his head, and one of the things that comes to mind is leptospirosis. So he sends off a test to test for leptospirosis, and sure enough, it comes back positive. How does leptospirosis cause these clinical signs? What is it exactly? And how can you as a pet owner avoid leptospirosis for your pet and even yourself? In today's video, we're going to talk about those things, and if you haven't already, hit the like button, as that really helps out the channel, and let's get started. Lepto is caused by a bacteria that looks a little bit like this. Now, this may look familiar if you've seen my video about Lyme disease, so if you haven't seen that, go check that out right here, or the link will be in the video description below. The reason that it looks similar is that they're in the same classification called a spirochete, and it's basically a bacteria that looks a little bit like a corkscrew. Now, specifically, leptospirosis has over 20 species that can cause disease that look the same and can cause similar symptoms. And within those 20 species, there's over 200 serovars. Now, a serovar is basically a bacteria's way of disguising itself, and it'll put different proteins on the outside of the bacteria that the body recognizes as different. So even though 4 or 5 different bacteria might be in the same species, they might have different protein capsules on the outside, and therefore the body will recognize them as different. And so it's one of the bacteria's ways to disguise itself from the body. So why do we care about leptospirosis? Well, one of the main reasons in veterinary medicine that we're most concerned about it is that it can actually be zoonotic, meaning that you can get it from your dog or from another animal. And as a human, it will cause very similar symptoms of liver and kidney disease, but it can also cause things like abortions in mothers that are expecting. So we are very concerned about this in animals and in people as well. Now, in animals, it can cause some very, very severe disease depending on the species that's affected, depending on the animal, depending on vaccination status, depending on a whole host of things. But in some animals, and with some serovars or even species of lepto, it can cause very minor to minimal disease, but they can be carriers for a very long period of time. This is especially true in some rodents, and some deer, and some other small carnivores, as they often won't be affected by lepto, or the clinical signs will be very minimal, but they can shed it for a very, very long time and put a lot of it out in the environment. So where do dogs and people get it? Well, as I just said, it's shed through the urine, and being that it's shed out in the urine, that's going to be the most common place that dogs and people get it. Now, lepto, once it's outside of the body can last a very long time in contaminated soil, in contaminated water sources, so puddles or even lakes and ponds. Less common in rivers, but still possible. Once you come in contact with this urine, whether it be through the ground, water, or directly in contact with urine, whether it's spread through mucous membranes of ingestion, or if it's water that's sprayed into the nose, or some other mucous membrane on the body. The other place that it can be spread is through cuts and abrasions. So if there's any break in the skin barrier, and if you want to learn more about breaking in the skin barrier, click this link up here. But these breaks in the skin barrier can actually cause lepto to be able to cross into the body and cause an infection. And then the bacteria will actually go and cause most severe disease in the kidneys and in some cases the liver. But it can also cause a generalized septicemia, so it can infect everywhere in the body and actually be replicating in the blood. And so this can cause some very, very significant disease. So what can you as a pet owner do for your dog to make sure that they don't get this disease? And even more so, what can you do as a pet owner to make sure your dog doesn't get it and give it to you or your children? Well, to be very clear, people don't get this very often, but it does still happen. But the number one thing that we've noticed and seen through the studies is that vaccines are probably the number one way to prevent leptospirosis in your dog. A dog that's been vaccinated is 20 times less likely to develop lepto than a dog that's unvaccinated. So there's a very strong reason here, especially if there's any risk, which we'll go into in a second, of your dog being exposed to lepto. Almost 25% of cases of lepto in dogs specifically are fatal. So 1 out of every 4 dogs that comes down with clinical disease is actually going to die. Now, there may be some carriers in here that would spread that number out of total infected, but we're not going to talk about that today. The other thing to remember is that just because you're in an urban environment does not necessarily mean that your dog can't be exposed to lepto. Mice, rats, raccoons, skunks are everywhere. So even if you're in the middle of New York City, if your dog could potentially cut themselves and step on a blade of grass that was peed on by a mouse, there's a risk of them getting lepto. Now, that does not mean that the Lepto vaccine is right for every single dog. That's a discussion you really should have with your veterinarian and weigh the risks versus the benefits. Because there's a lot of people who really believe that there's a higher risk of vaccine reactions with the Lepto vaccine compared to the normal distemper vaccine. Now, in clinical practice, we've had a lot more with just the regular distemper than we have with our combo vaccine. So make sure you talk it over with your veterinarian before you vaccinate, or even before you decide, hey, this isn't right for my pet. The most common areas in the US that have lepto in dogs are going to be the Midwest and the Southwest. So if you live in one of those areas, you really should especially be considering the Lepto vaccine, but that doesn't mean that it's exclusive to those areas. It really will cause infections throughout the country, and it's considered ubiquitous in the United States. So to finish up the story from earlier, the dog did fantastic with some antibiotics and recovered with very limited symptoms. The people did great because they wore proper protective equipment once they knew what was causing the disease. So no people came down with lepto, and the dog did fantastic. So the moral of this story is, 1, very highly consider the vaccine. And number 2, make sure you talk to your veterinarian if your dog's showing any clinical signs that are abnormal. So if there's any jaundice, or if there's any difficulty breathing, or if your dog is just not looking right, make sure you talk to your veterinarian, as there could be something else going on. So if you guys have more questions about this topic, make sure you leave a comment down below. And if you haven't already, I would really appreciate it if you would subscribe, because that really helps out the channel. And if you do hit the notification bell, you'll be notified as soon as a video is live. I'm trying to publish every Tuesday and every Friday, so twice every single week, in trying to build the channel as quickly as I can. So I hope you guys enjoyed it, and if you didn't, hit the thumbs down. If you did, hit the thumbs up. We'll see you guys in the next one.